Welcome to Med Talk by Galloway-Sands Pharmacy. I'm Brad here with Kassidy. And Kassidy, one of the hardest numbers for folks to hear at the pharmacy counter is not a blood pressure reading or a dose. It's when we say this may take days or even weeks before you really feel the benefit.
The days or weeks part is exactly what throws people. Because if they swallowed it this morning, they're thinking, okay, it's in me. It's in my bloodstream. So why am I not better by dinner?
Right, and that question makes perfect sense. A medicine can be present in the body and already doing something on a receptor, an organ, or a signaling pathway long before the person notices symptom relief. Working in a pharmacology sense and I feel better are not always the same clock.
That 2 clock idea is helpful. So 1 clock is the drug got absorbed. The other is my body has actually caught up enough for me to notice a change.
Exactly. Take SSRIs, medicines often used for depression or anxiety. Those start affecting serotonin signaling fairly early, but the clinical effect, meaning the mood or anxiety improvement someone can actually feel, often takes longer. Different medicine, different dose, different person, timelines vary. But the key point is the early chemical change is not the full story.
And SSRIs are a good one because people really do expect a light switch. I've heard versions of, I took 2 doses and I still feel the same. And they're not being dramatic, they're just hoping for relief.
Sure, if you felt lousy for weeks or months, waiting one more week can feel long. I remember counseling patients who wanted that first tablet to feel like taking a headache medicine. But an SSRI usually isn't that kind of medicine. It's more like turning a big ship than flipping on a lamp.
A big ship, yes, not a jet ski. So what about blood pressure medicines? Because that's sneaky. Sometimes people don't feel high blood pressure in the first place.
That's a great example. With blood pressure treatment, the medicine may begin affecting blood vessels, heart workload, kidney handling of salt and water, or hormone signals that control pressure. But the body is a balancing act. It may take time for readings to improve consistently, and even more time before that new pattern settles out.
Wait, kidney handling of salt and water is the part I'd circle. You're saying it isn't just one pipe getting squeezed less. It's the vessels, the kidneys, the fluid, the whole plumbing system.
That's it, a system, not a switch. And then hormones are another category people misunderstand. Hormone therapies often work through signaling that tells cells to change what they do. Cells may need time to respond, tissues may need time to adjust, and benefits may show up gradually rather than all at once.
So if somebody says, I started hormone therapy and I don't feel dramatically different yet, that doesn't automatically mean it's failing.
Correct. It may simply mean the body's response takes time. Not every symptom improves on the same timeline, and not every medicine feels obvious right away. That's why we try to set expectations early, so people don't give up on day 3 of something that was never supposed to finish the job by day 3.
And honestly, that expectation piece matters. Because when people think fast relief is the normal outcome, anything slower feels broken. When really, slower can still be completely normal. Okay, so let's get under the hood a little. You said SSRIs can change serotonin signaling early, but mood takes longer. Is that basically a receptor issue?
Receptors are a big part of it, yes. The early medicine effect may happen pretty quickly, but the brain then has to adapt downstream. Receptor sensitivity can change, signaling patterns can adjust, and what people often hear called neural plasticity, the brain's ability to adapt and rewire, may be part of why improvement is delayed. So the medicine isn't doing nothing. The visible benefit is waiting on a larger biological response.
Neuroplasticity. That's the phrase I'd want translated. You're not saying the brain becomes plastic, you're saying it can remodel, kind of retune itself over time.
Exactly. Retune is a good plain English way to say it, and that takes longer than simply getting a pill absorbed. Same theme with blood pressure medicines. Lowering pressure is not always instant because the body has feedback loops. If one part gets nudged, another part may push back for a while. Blood vessels adjust, kidneys adjust, fluid balance adjusts, and that counter-regulation can make the settling process slower than patients expect.
Counter-regulation is such a useful term. Like the body saying, oh, we're changing this, let me try to pull us back. So if a patient checks one reading and it's not perfect, that one reading may not tell the whole story.
That's right. One number, one day, one dose, those don't always tell you where the trend is headed. The goal is not to panic over every single data point. It's to follow the plan your prescriber gave you and communicate if something seems off, especially side effects or readings that concern you.
And hormone therapy may be the slowest feeling category for some people, right? Because now we're talking gene signaling and tissue response, not just a quick chemical nudge.
Yes, hormones often act like messengers that tell cells which proteins to make, how to behave, and how to rebuild or maintain tissue. That means cells need time to respond, and tissues may need time to remodel before the benefit becomes obvious. So with hormones, patience is not just emotional advice, it's built into the biology.
Built into the biology, that's the line. Because people can feel like they're failing if they don't notice a difference fast. But the cells are basically still reading the instructions.
Well said. And here's the counseling takeaway I come back to all the time. Don't stop or change a medicine on your own just because it didn't deliver instant relief. And don't sit quietly if you're worried. Check back in with your pharmacist or prescriber. Tell us what you're feeling, what you're not feeling, and when you started. That helps us figure out whether what you're experiencing fits the expected timeline or needs attention.
I like that because it's both reassuring and practical. Stick with the plan, but don't disappear. If it's been a reasonable amount of time, and that depends on the medicine and the dose, ask questions. Call. Come by. That's literally what we're here for.
Exactly. Sometimes the most important part of a medicine isn't just the bottle. It's understanding the timetable well enough to give it a fair chance.
And maybe that's the real tension, huh? Not, is the medicine working, but what kind of work is it doing today that I just can't feel yet? Thanks for listening to Med Talk. Feel free to contact us with any questions you might have. We are here to support every one of your health needs. Supply location: 58 Physicians Drive Northwest, number 5, Supply, North Carolina. Open 9 a.m. to 6 p.m. You can call us at 910-754-7200. And Southport location: 1513 North House Street, number 8, Southport, North Carolina. Open 9 a.m. to 6 p.m. And you can call at 910-454-9090.